you.
Good morning. I'm Dr. Jennifer Tong, Associate Chief Medical Officer for Santa Clara Valley Medical Center. This morning I'm also joined by James Williams, County Counsel for the County of Santa Clara. I will be providing updates regarding the county's submission of its vaccine plan to the state of California, as well as the hospital capacity in the county. James will then be providing information regarding the county's mandatory quarantine after travel. The two biggest things that I have to share with you today are that we're making progress in the planning around vaccine distribution in our county. But we're still extremely concerned about having enough beds and staff to care for those who are ill in our hospitals. Therefore, everyone must continue to do their part to slow the spread of COVID-19 and help keep their loved ones and our entire community safe in the weeks ahead. I'm pleased to share with you that yesterday we did submit a vaccine plan for the County of Santa Clara to the state of California. This is a plan required of all counties by the state. We will make that available to the public and to all of you on our website as soon as possible. The plan describes at a high level how we will engage the community and how we will join with healthcare partners to distribute vaccine allocated to us by the state. Our top priority is the safety and health of people who live and work here in Santa Clara County. A tool in helping us reach that top priority is a safe and effective vaccine that has been rigorously evaluated for safety and efficacy by the federal government and by the state of California. We are hopeful in this goal based on what we have seen so far. Let me emphasize that we all must continue to do our part to stay safe while we wait. Many countries and states and counties want access to vaccines, and like everyone else, we will receive a limited supply at first. More will be coming over time. It might take many months, though, before everyone who is interested in getting a vaccine is able to get one, which means that we will all need to do our part to continue to reduce our risk of COVID-19 by engaging in the behaviors that protect ourselves and others, like wearing face masks, continuing to keep our distance, and not gathering with others outside of our households. The county's role and responsibility for any COVID vaccine is logistics, planning and preparing for the distribution of one or more vaccines. We will be prepared to distribute doses of vaccine allocated to us from the state. This is part of our commitment to the health and safety of those who live and work here. This is part of the work that public health is built to do. The distribution of vaccine will be in accordance with the prioritization requirements set forth for us by the federal government, along with additional recommendations from the state of California. At first, the amount of vaccine will be limited. The national system of prioritization will direct the first doses to people who are at the highest risk, including those who work in healthcare and are on the front lines of exposure to COVID-19. We will work with the community to keep them informed and ensure that information about the vaccine reaches our hardest hit communities, with an understanding that it is important for people to have trust in an effective vaccine so that it has the power that we need it to have to save lives. This positive news about vaccine planning comes amidst a time of record cases and hospitalizations for COVID-19 in our county. The number of patients hospitalized with COVID-19 in our hospitals continues to rise. We continue to be at risk of exceeding our hospital capacity, with typically used beds in our hospitals potentially exceeding capacity by mid-November if the trend continues. As of December 1st, ICU occupancy among hospitals traditionally serving the South County and the east part of San Jose, their ICU occupancy was at 93%. The ICU occupancy for other hospitals in the county was at 84%. We are especially concerned because none of the hospitals serving South County and East San Jose had more than 5 ICU beds available as of yesterday. Those counties in particular serving South County and East San Jose include Regional, Kaiser Santa Clara, and our 3 county hospitals, Santa Clara Valley Medical Center, O'Connor Hospital, and St. Louis Regional Medical Center. What this means is that the hospitals in our hardest hit communities have the fewest beds available for those in need. Our hospitals throughout the county are working together, engaging in phone calls at least daily to redistribute patients as needed to ensure that we are continuing to provide safe and high quality care to all of those who seek it. But these numbers are gravely concerning. We want you and your loved ones to get the care that you need at our hospitals if you become seriously ill. We each must do our part to slow the spread of transmission and protect our hospital capacity, thereby protecting those who live and work here. Thank you. With that, I'll turn it over to James.
Good morning. My name is James Williams, and I'm the County Counsel for the County of Santa Clara. Mostly here to answer questions, but wanted to just make a couple points initially. First is that we are still in the midst of this really concerning surge in cases and hospitalizations. And that is why on Saturday, Dr. Cody took the steps to put in place some additional layers of protections to help try to slow that train down, to try to bring down that growth in cases. One of those very important measures was the new directive related to travel. And Dr. Cody and others had been communicating clearly, locally, for many weeks to discourage travel and gathering during this holiday season. The state has been putting out the same message. The CDC has been putting out the same message. And the reason that there's been so much concern about that is because we know that that volume of mixing of households and the surge in cases across the United States could really be an accelerant in leading to much additional growth in cases and therefore serious illnesses and hospitalizations. The reason for putting in place a quarantine requirement for people returning from out of the area is to try to help avoid some of that growth in cases, to hopefully help contain spiraling chains of transmission that would occur from folks who did choose to travel nonetheless. And that's why we have this in place. We know we received a number of questions about it. We have put up a clarified version of the directive, which in greater detail breaks out the few categories of exceptions along with updated frequently asked questions. I'm happy to answer some questions around that this morning, but it remains a very broad mandate, and the reason for its breadth is to really, at this critical moment, capture that travel that may have occurred or that may be occurring and have folks really be in quarantine to avoid inadvertently spreading this disease. We know now that potentially a majority of cases are actually spread by people who do not have symptoms. And so you can't really know. And we also know that testing isn't perfect. We do encourage people to get tested. We do have tremendous amount of testing capacity available, accessible to the community. It's important that people utilize that. But because of how testing works, just because you may test negative on a given day, all that means is that you did not have detectable levels of virus at that moment in time. And it doesn't tell you what might happen after that specimen was collected. And so testing is not a perfect measure. It's just another layer of protection. It's just another way to try to help detect what's going on and break chains of transmission. The travel quarantine is yet another important protection in this multi-layered effort to try to control the surge in cases and to try to ensure that we have adequate hospital capacity, as Dr. Tong mentioned. So with that, I think we we'll open up to questions.
Yep. We'll move across with the crowded house. We'll start here with ABC. Question for Dr. Tom.
Hi, Dr. Tom. Can you provide an update on a status update on elective surgeries within the Valley Medical Center health system, and if there are any plans to suspend those procedures in the coming weeks, and if not, what it would take, and what are some of the metrics that you'll be looking at for something like that?
Sure. The question was around elective surgeries and elective procedures in our hospitals, whether or not those have been suspended and what it would take for those to be suspended. What I can say is that more than one hospital in our county, and more than just a hospital operated by our county, have made the decision to suspend some elective surgeries and procedures, particularly those that will require an inpatient bed, and particularly those that will require an ICU bed. Part of the rationale for suspending those surgeries is to balance the bed availability for those who need them most. And there are clinical decision makers at each hospital who help weigh the risks and benefits of delaying such elective procedures. At this point in time, each hospital continues to make those decisions depending on the state of their staffing and their bed availability, which changes from day to day and even from hour to hour.
Go to CBS next.
This question is for William. Is it fair to say that the travel quarantine relies on self-enforcement and the honor system? And what is the mechanism to penalize egregious offenders?
Sure. So the question was, does the travel quarantine rely on the honor system, and what's the mechanism to penalize offenders? The health orders, including the travel directive, but along with all of the other ones, the face covering requirements from the state and at the local level, the many other health orders, just like, by the way, most laws in our society, rely on us to do the right thing and do our part on a daily basis, right? That's true of every law that we have out there. But there is also enforcement. And I think most people understand that those things go hand in hand, but that doesn't mean that every single everything is the subject of a enforcement action at all times. The directive is mandatory. It is part of the compliance efforts like all the other health orders. People can submit complaints to sccovidconcerns.org, and we will follow up on those. But just like our expectations around face coverings, just like our expectations around social distancing, we absolutely need to all do our collective part. And I think in this county in particular, folks have actually been really extraordinary about doing that. And I think people also understand that in the midst of this highest surge yet, when cases are rising at the highest rate ever during this pandemic, that now is the most critical time to take action right now. And so if you have traveled, this is the concrete thing you can do to help avoid inadvertently setting off a chain of transmission that could affect countless others.
Next question from NBC.
This is for Dr. Tom. Hi, Dr. Tom. Can you tell me when you anticipate that a vaccine will be available for children? And once it is, do you think that there will be a mandate that school-age kids must have it before returning to school?
The question was about vaccine availability for children and whether or not there would be a mandate for children to have that vaccine before returning to school. At this point in time, I can only say it's just too early for us to tell. The results of the clinical trials are still underway, still being evaluated, and At this point in time, children would not be most likely in the phase 1A highest priority population, which includes healthcare workers and those who are living in congregate long-term care facilities. While there might be a few children in that population, the vast, vast majority are not going to be children. So our current focus right now is around that first priority population.
We'll go to Mercury News next.
Can you talk about what the county's allocation for the state would be, and what percent of our county health providers and long-term care residents would be getting that, and planning for the distribution?
The question was about the allocation amount the county will receive of vaccine from the state and what percentage of healthcare workers and long-term care facility residents that will cover. The answer I have for you today is that number is evolving, particularly because there is more than one vaccine that is scheduled to be reviewed by the FDA over the next couple of weeks. The numbers that we receive over the next few days might change as an additional vaccine is reviewed and most likely will be approved. So what we know is that we are prepared to distribute the allotment that we receive from the state. We do anticipate that there will be some additional refinements of prioritization that we will likely receive from the state of California to help guide how the initial doses are distributed in a prioritized way among healthcare workers, particularly those who are caring for patients with COVID-19.
We'll go to KCBS.
So given the number of uncertainties that there are surrounding vaccines at this point, what is the county able to plan? Like what do plans actually look like at this point?
Sure. So plans have included identifying the vaccine administrators across our county, the different providers and systems that are able to administer the vaccine, working with them to estimate the initial numbers that they can handle in terms of storage, ensuring that they have preparations in place and supplies in place for storage, including the ultra cold freezer storage that is required for at least one of the vaccines. And then working with them in terms of the data transmission, ensuring that those who are vaccinated are recorded in an electronic system in a way that we can track how many people are being vaccinated from what zip codes, what age groups, and that information is transmitted to the state in a way that the state requires.
For KRON.
Question for the county council. I'm wondering, was consideration given to announcing the travel quarantine prior to Thanksgiving? That might have discouraged some people from traveling, and would that have made any difference?
So the question was consideration given to announcing it prior to Thanksgiving? What I can say is this policy was developed afterwards, and so there was a strong discouragement of travel that was issued beforehand, and then throughout the course of that week, I think all of you saw along with us the growth in cases, the growth in hospitalizations that really pushed the need to take some more significant actions. And so this was one of the actions taken as soon as that decision was made and it was ready. The hope is, having put it in place pretty quickly and being one of the first jurisdictions to do so, that it will make a really meaningful difference. But the basic recommendations had actually been out there for quite some time, including not just the discouragement to travel, but that people should quarantine if they do travel. That had been emphatically out there from many sources, including the county, preceding the Thanksgiving holiday.
We'll go to San Jose Spotlight.
Hi, I have a question for Dr. Tom. How are you?
Good, thank you.
Good. When a vaccine is approved, how many doses does the county expect to have, and how many freezers does it have to store the vaccine?
So the question was, when the vaccine is approved, how many doses does the county expect to have, and how many freezers are there to store the vaccine? The answer, as I was just answering previously, is that the number of doses that we will receive will evolve quickly over time, since there is more than one vaccine that is scheduled to be reviewed by the FDA over the next 2 weeks. So we do not yet have firm numbers on the exact numbers that we will receive, but we are prepared to store and then distribute the full volume of what we do receive. In terms of the number of freezers, I do not have an exact number right now because that number actually evolves on a daily basis. I literally, before coming to the press conference, was on the phone with a group that was telling me that freezers had arrived on a truck as of yesterday. Multiple freezers have been installed in parts of the county buildings that we own and operate, and there are additional freezers that are being purchased and installed by other private healthcare providers as well.
We'll do a couple more questions, right back to NBC.
Dr. Tom? Dr. Bernier? Hi. For healthcare workers and even members of the general public who may have concerns about the safety of this vaccine, can you address that? And also, which vaccine will the county likely get from which pharmaceutical company?
So the question was if I could address concerns that those in the highest priority population, particularly healthcare providers, might have about receiving the vaccine, and if we know from which manufacturer we will be receiving vaccine. I'll answer the second question first. My expectation is that we will receive vaccine from multiple manufacturers to distribute throughout the county. We are prepared for that. Once someone receives a first dose from a manufacturer, it's important they receive the second dose from a vaccine from that same manufacturer, and we have worked that complexity into our planning. In terms of the concerns around safety and efficacy of the vaccine, what I can say is that the vaccine has undergone clinical trials with thousands of people receiving it over the last many months. What I hear from several friends, colleagues, even family members is that they don't want to be the first person to receive the vaccine. And my response to that is, thank goodness you won't have to be the first, because we've had people who have volunteered to be the first as part of these clinical trials who have been closely monitored, and the federal government and the state government, as well as multiple experts in vaccinations, public health, and healthcare are reviewing the output of those trials and providing that data, information, and recommendations to us.
Dr. Tom, real quickly, could you clarify which of the hospitals you were referring to that have suspended elective surgery?
Because that is ever evolving, I'd rather not mention specific hospitals right now. At times, it's not a blanket suspension or cancellation of surgeries. Sometimes it's on a day-by-day basis, so it evolves sometimes even hourly.
Is that a county-owned hospital or a hospital within the county?
Both.
Robert, wanted to see, how did you arrive at 150 miles being the distance that you felt needed enforcement? Is there any idea of maybe evolving or changing that? And do you have a plan for more stepped-up enforcement if it turns out it's not working?
Sure. So the first question was, how did we arrive at 150 miles as the radius? And the second question was, is there a plan for stepped-up enforcement if the current situation is not adequate?
And whether you might change 150 miles?
And whether the 150 miles may change. The 150 miles was arrived at trying to come up with an appropriate area that would account for the fact that there are a lot of people who travel but for work on a regular basis or live and work across county borders within a few hours of Santa Clara County, but wanting to ensure that folks who where there's significant surge in cases, such as from Southern California, such as from other parts of the United States, people may be coming in by air or from long distance travel, would be subject to the quarantine. And so the 150 pretty much covers that sweet spot between the two in a clear, demarcated manner. We, of course, will be always examining, as we have with our other directives, their efficacy, but also whether updates need to be made. We've done that throughout the course of the pandemic with every single subject matter and area, and this will be one of them. And we'll also continue to look at what's happening elsewhere in the state, what's happening elsewhere in the United States, and what's happening, of course, locally with our cases in the surge. And finally, with respect to enforcement, we continue to evolve that program. We absolutely encourage people, if they have concerns about this or any of the health orders, to bring those to our attention at sccovidconcerns.org. And we do follow up on those. And that program continues to expand in an effort to really promote across the board adherence with these really important and critical safety precautions.
We'll go one more, or two more final questions. Start with CBS.
Mayor Sam Liccardo has admitted to violating the state mandate for private gatherings. Does he face any repercussions or any consequences?
We have become recently aware of that issue, and that's something that's under review.
Carolyn?
James, I'm wondering if we hear a lot about the fact that there may be a new shelter-in-place order statewide. Are there plans in the works for that now? What would that look like? Similar to what happened in March?
So we know the same news that all of you are aware of from the state, where the governor made clear that if things are not looking good, and he talked about hospitalizations and ICU capacity specifically at his press conference, that the state is prepared to take further measures. What I would say is that from our perspective, we think it is absolutely critical that there be bold and swift state and federal measures to deal with the surging cases that's happening across California and across the United States. One thing we do know is that our local measures by themselves are not enough. They're not sufficient without these broader steps being taken at the state and federal level both. And we really would like to see the state and the federal government taking those appropriate steps in order to ensure that we're all much safer and to ensure that community transmission is at a much lower level.
We'll close up the final question from the Mercury News.
So the CDC is trying to inform the lottery.
So the question was, the CDC just today has issued some revised quarantine recommendations. We will be reviewing those. They are actually a bit nuanced, a little more nuanced, I think, than some of the initial reporting. And that will be reviewed by public health, and as appropriate and if necessary, we may make adjustments. But as of right now, the county's quarantine requirement is 14 days across the board.
We'd like to thank everyone for being here. We will be available for questions in other languages, including Spanish, Chinese, and Vietnamese. And enjoy the rest of your day, and thanks again.
As we begin Spanish, we ask everyone to please be aware of the cameras behind you so that we don't cross their screen when they're trying to get questions.
Buenos días, mi nombre es Corina Herrera Loera, oficial de Información Pública para el Condado de Santa Clara. Queremos dejarles saber que presentamos ayer un plan de distribución de vacuna COVID-19 al Estado como parte de nuestro compromiso con la salud y la seguridad de la comunidad. La cantidad inicial de vacunas disponibles será limitada. Al igual que otros condados, el condado de Santa Clara seguirá el sistema nacional que dirige las primeras vacunas a los trabajadores de salud. La priorización requiere para la vacuna que se establezca por el gobierno federal, con pautas adicionales del gobierno estatal. Este plan de vacunas del estado por parte del condado tiene dos componentes. El condado recibirá algunas dosis directamente de los fabricantes para las vacunas en los hospitales y sitios operados por el condado. Otros proveedores de atención médica recibirán dosis de vacunas directamente de los fabricantes según lo indique el condado. Es probable que las primeras vacunas requieran una logística compleja. Actualización de hospitalizaciones. Con el aumento récord de casos y hospitalizaciones, estamos particularmente preocupados por mantener la capacidad de hospital, especialmente dado el aumento de casos después de los días festivos de la semana pasada. Ninguno tiene más de 5 camas disponibles. Se desaconseja que cualquier viaje que no sea esencial y se mantienen las reglas para la cuarentena obligatoria de 14 días después del viaje, más de 150 millas fuera del condado, sean residentes o no residentes. La directiva obligatoria sobre viajes fue revisada el 2 de diciembre para aclarar que solamente algunos profesionales de la salud con licencia y otros profesionales que viajaron únicamente con el propósito de realizar una función gubernamental esencial según lo define la orden. La información detallada sobre esta cuarentena y los recursos para ayudar con la cuarentena están disponibles en nuestro sitio web del condado. Urgimos a todos los residentes de nuestro condado que continúen haciendo su parte para reducir la transmisión, usando su cubrebocas, manteniendo la distancia social y evitando el contacto con personas fuera de su hogar. Gracias. Después van a venir otros lenguajes y puedo estar ahí.
Xin chào quý vị, tôi là Khánh Ly, là nhân viên truyền thông của quận hạt Santa Clara. Ngày hôm nay, quận hạt Santa Clara đã đưa ra một buổi họp báo để công bố kế hoạch phân bổ vaccine. Theo đó nêu chi tiết về việc quản lý vaccine, cộng đồng có thể nhận vaccine bằng cách nào và cách phân phối vaccine COVID-19 như thế nào sau khi quận hạt nhận được vaccine từ tiểu bang California. Số lượng vaccine ban đầu được đưa xuống sẽ có hạn, thì giống như những quận hạt khác, quận hạt Santa Clara sẽ tuân theo chỉ thị của quốc gia. Đầu tiên sẽ phân bố thuốc chủng ngừa cho các nhân viên y tế ở tuyến đầu, vì những nhân viên này là những người có nguy cơ cao nhất nhiễm COVID-19. Chính phủ liên bang cũng có những ưu tiên về việc phân bổ thuốc chủng ngừa cùng với những hướng dẫn bổ sung của chính quyền liên bang. Việc phân bổ thuốc chủng ngừa mà quận hạt nhận được từ tiểu bang sẽ có hai phần chính, thì quận hạt sẽ nhận những liều thuốc trực tiếp từ các viện bào chế và cung cấp những cái liều thuốc này cho các cơ sở y tế và những địa điểm được quận hạt điều hành. Thứ hai là các cơ sở chăm sóc y tế khác sẽ được nhận những liều thuốc chủng ngừa này trực tiếp từ các viện bào chế theo chỉ thị của quận hạt. Những liều thuốc chủng ngừa này đòi hỏi cần phải có những cách bảo quản thích hợp, ví dụ như là phải để ở cái nhiệt độ lạnh như thế nào đó để có thể thuốc chủng ngừa này được bảo đảm cái chất lượng cao nhất. Thành ra là những cái cơ sở nào được phép có thuốc chủng ngừa, bảo quản thuốc chủng ngừa và việc phân bổ thuốc chủng ngừa cho cộng đồng, điều này sẽ được quận hạt kiểm tra và chỉ định. Các tổ chức khác có cơ sở ở trong quận hạt, chẳng hạn như các cơ quan chính phủ liên bang hoặc là các hệ thống chăm sóc sức khỏe lớn cũng có thể được chính phủ liên bang hoặc là bang California phân bố thuốc chủng ngừa trực tiếp. Kính thưa quý vị, sau tuần lễ Thanksgiving thì chúng tôi đã nhận được những dữ liệu về những con số nhiễm COVID-19 và số lượng nhập viện tăng mạnh. Những bệnh viện bình thường phục vụ cộng đồng ở phía nam của quận hạt và những cộng đồng ở East San Jose đã không còn đủ giường bệnh cho những trường hợp bị bệnh nặng nữa. Chúng ta chỉ còn có 10 giường bệnh cho những giường bệnh chăm sóc đặc biệt mà thôi. vào ngày 1 tháng 12 năm 2020 là mới vào ngày hôm qua thì chúng tôi có thống kê là 287 bệnh nhân đang phải nằm viện, trong đó có 50 trường hợp là nằm viện mới. Đó là lý do tại sao chúng tôi đã đưa ra một chỉ thị bắt buộc phải cách ly dành cho những cư dân đang sinh sống và làm việc tại quận hạt Santa Clara. Đi ra khỏi quận hạt 150 dặm và trở về thì quý vị phải cách ly trong vòng 14 ngày. Thêm vào đó thì những khách hàng đi vào quận hạt Santa Clara, quý vị cũng phải cách ly 14 ngày. Đây là chỉ thị bắt buộc của quận hạt Santa Clara. Chúng tôi cũng có những trường hợp miễn và những cái quy định cụ thể nằm trong chỉ thị này. Quý vị có thể tìm cái chỉ thị này trên trang mạng của Sở Y tế Công cộng quận hạt Santa Clara với nhiều ngôn ngữ khác nhau, và nếu như quý vị muốn tìm được tiếng Việt thì quý vị hãy vào trang mạng www.scc.gov.org/CV19-Việt. Chúng tôi xin chân thành cảm ơn và cũng mong là quý vị sẽ cùng chúng tôi hợp tác với chúng tôi thực hiện những cái chỉ thị được đưa ra để chúng ta có thể ngăn chặn được cái sự lây lan của coronavirus. Xin cảm ơn.
大家好，我是圣塔克拉拉县紧急行动中心的公共信息官 Ann Chan。今天的记者会有几个重点，第一个呢就是疫苗，第二个是住院的人数更新，第三个是旅行的强制性检疫。关于疫苗呢，今天圣塔克拉拉县向州政府提交了疫苗的计划，说明了对于疫苗的管理、社区分配还有社区的参与计划。那第一批的疫苗呢，会分配给感染 COVID 风险最高的前线医护人员。对于疫苗所需的优先顺序，则会由联邦的政府所制定，州会有其他的另外的规定。对于取得疫苗的两种途径，圣塔克拉拉县将会对跟制造商取得一些剂量，以便在圣塔克拉拉县的医院直接的接种。对于县里面其他的医疗机构，将会依照县府的指引，而县政府会做评估，对于其他县里面机构保存运送的能力来做评估而分配。对于住院的人数还有病床的更新，住院人数在感恩节之后是持续的增加。县府目前必须要做到的是维持医院的负荷量。那截至12月1号为止，有287个住院的人数，而我们的 ICU 已经有80%的饱和量。关于旅游的强制检疫措施，这项措施不管是居民或非居民都必须遵守。那今天也做了更清楚的说明，如果您是旅游超过150英里到了圣塔克拉拉县，如果您是为公家机关而出差，或者是来圣塔克拉拉县做医疗的工作，或者是您是病人来圣塔克拉拉县做医疗的服务的话，您不需要做检疫。其他更多的详情，请参阅 www.scc.gov.org/COVID-19， 可以选择中文的页面。谢谢。